Hello, Clinic Review families. Dr. Sharon with Clinic Reviews. Today we're going to focus on psychosocial integrity. As you know, I'm going through the RN test plan, Nclex RN test plan, picking out topics. This one is going to be about abuse, neglect, and coping. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the home of the very best Nclex review in the entire universe. In my opinion, Mark Klimek is the GOAT of Nclex review. You know that this channel focuses primarily on Nclex prep, but we focus on the things that the Clinic review does not cover. The Clinic review in and of itself is what you need to pass Nclex, but there are people who maybe their education wasn't exactly what it should have been, or maybe they graduated a long time ago and they need a little bit more help. So we cover additional things here. You can get the full 21 plus hour Clinic review at clinicreviews.com. And we also have a streaming service, and we have small group tutoring. The small group tutoring is a 4-session package over a month where you get live Zoom tutoring. I do 2 of them. So if you want to meet me live over Zoom, you can do that. We also record those so that you can watch them later if you would like to. So let's go ahead and get started. Let's see what we've got here today. Psychosocial integrity. A home health nurse visits a 7-year-old who has multiple bruises of varying colors on the trunk and upper arms. Which action is the nurse's priority? So this means if I can only do one thing, what one thing do I have to do? Ask the child's caregiver for an explanation, document the location and size of each bruise, report the findings to the local child protective agency, or teach the caregiver about injury prevention. So, when you suspect abuse, we are obligated to report it. This is the kind of question that you have to think, what am I legally obligated to do? And I have to do that. You may say, well, first I would ask the caregiver about what happened, right? Like maybe I'd want to do that first. Maybe I'd want to document it second. Maybe I would want to teach them third. And then last, after a full assessment, doing all these things, I would report it. But this is not a first question. This is a priority question. And if you can only do one thing, you have to do what's legally obligated for you to do. And so you have to report the findings to the local child protective agency. Now, it could say called child abuse hotline. There's a number of things ways it could be phrased, but we are mandated reporters. And if you suspect abuse in children or especially in the elderly, we are obligated to report it. So don't say, well, I don't know if that's really, maybe they're not being abused. You're right. Maybe they're not, but we are mandated reporters and we have to report it. During morning rounds, a client with schizophrenia paces, clenches fists, and stares at staff, which initial intervention best reduces the risk of violence. Now, just so you know, pacing, clenching fists, or pounding fists together is the classic example of agitation that leads to violence. Okay, so this is the way the NCLEX always tells you they're about to become violent. So these should be red flag words. The words of a question matter, and these are the words that matter. So what do you want to do to reduce violence? And even if it said, what should you do? Like, it's the same thing. Even if it said, what's your priority would be to reduce violence, right? All right. Administer PRN Haldol, use a calm voice and direct the client to a quiet room, activate a code gray psychiatric emergency, or instruct the client to sit and stop pacing. So we don't give antipsychotics for violence. We may have to after we've taken them down. There may be at some point we need to medicate them, but we don't do that first. We try to de-escalate. So our job is to try to de-escalate. A is not de-escalating. B, calm voice and isolating them. Isolating them is different levels. You could isolate them in the hall. You could isolate them in a quiet room. Okay, isolation is a de-escalation tactic. So B is de-escalation. C is not de-escalation. And D is not de-escalation. So telling them to stop pacing is not de-escalation. They're agitated. They feel like they need to get some of their agitation out. So I'd rather have them pacing than hitting the wall or hitting me. But we do need to de-escalate, and de-escalation involves using a calm voice and isolating them from others. A quiet room is as good a place to isolate them as any. The multidisciplinary team is developing a plan for a child with autism who exhibits self-injurious headbanging. Which behavior management strategy should the nurse recommend? Select all that apply. So we want to prevent self-harm here, okay? Apply a soft helmet during episodes, use positive reinforcement for alternative behaviors, implement a token economy system for daily goals, administer PRN benzodiazepines for each episode, provide a structured schedule with minimal changes, ignore the behavior, and avoid reinforcement. So we want to see what we can do to prevent self-harm and to prevent the behaviors, right? So we're going to choose answers that either prevent self-harm or encourage different behaviors. So applying a soft helmet during episodes prevents self-harm. So that's a good idea. Positive reinforcement for alternative behaviors. What that means is when they don't headbang, okay, so when they don't do self-injurious behaviors, don't injure themselves, but instead they maybe they walk around the house, or maybe they scream into a pillow, other things that maybe we've taught them to do to manage their anxiety, we give positive reinforcement. So that's a good job, Johnny. You didn't hurt yourself. You managed your anxiety in a different way. So B is a good answer. Implement a token economy system for daily goals. So I wanted to make sure those of you who don't know what this means, a token economy is giving them something when they meet their daily goals. But we don't want to do just total. It's reward. It's a token that they want to get, but it's not like candy. So we're not really encouraging good behavior with things that are not great for them. So token economy may be a sticker, right? You get, if you met your daily goals today of not harming yourself, you get a sticker, and you get to pick the sticker out of this. It may literally be a token. Maybe it's a baseball card. Maybe it's literally just a token that they can collect. And the more they collect, the more they go, look at how good I've been lately, right? I haven't done this at all. And they get to collect these. So it's not about rewarding them with like food or anything, but it's a token that doesn't necessarily cost anything or doesn't cost much. It's not expensive. We're not rewarding them with a new iPhone, right? We're just doing a token when they do when they meet their daily goals. Administer PRN benzodiazepines. Benzodiazepines are mild tranquilizers. They're addictive. We are certainly not going to give an addictive tranquilizer to children for each episode. Provide a structured schedule with minimal changes. So that is good for autism. Structured schedules with minimal changes helps reduce anxiety and agitation, which should reduce the violent self-harming behavior. So E is a good option. Ignore the behavior and avoid reinforcement. That we don't ignore it. Don't ever choose to ignore it. That's not a good option. An older adult with dementia repeatedly tries to strike staff during evening care. Which behavior management technique is most appropriate? So before I read the answers, I always try to think what would be a good option. So certainly we want to do de-escalation. Routine may be helpful. There may be a routine component to this that may help. Tone of voice may help. So let's see what the options are. Apply 4-point soft restraints at bedtime, administer a sedative 30 minutes before care, limit fluids after 1700 to reduce nighttime agitation, assign the same caregivers each evening. So applying restraints is not de-escalation. It's not a positive reinforcement. It's not using a calm behavior. So I don't like that. Administer a sedative. Sedatives are not known to help with dementia and confusion. So I don't want to do that. Limiting fluids isn't going to do anything for violent behavior. Like that might help if they're incontinent, but it's not going to help with violence. Assign the same caregivers each evening. So I wasn't thinking about that, but I was thinking about using calm voice and using behaviors that were helpful to them, having a routine. I said having a routine might help. And so sort of assigning the same caregivers are sort of like having a routine, right? You know what to expect. You know the people, they do things in a certain way, and that may reduce the agitation of the client. So D is your best answer. Remember, the right answer is the right answer because of the other answers. So none of the other answers are conceptually what I was looking for. D is the closest to what I was looking for. A school nurse suspects child abuse. Which actions are legally required? Collect statements from classmates for evidence. Notify local child protective services. Document objective findings in the child's record. Contact the child's parents for clarification. Continue to assess the child for additional injuries. Photograph the injuries per facility protocol. So legally required is a key word, legally. So am I legally required to ask classmates? As the nurse, no. The police might have to, but the nurse is not legally required to collect statements from classmates. We're not legally required to do an investigation. We have to report it so that people who are in charge of doing the investigation can do the investigation. So B, notify local child protective services. That is legally required. I'm a mandated reporter. Document objective findings in the child's record. That is mandated. I have to do that. Contact the child's parents for clarification. So again, that's doing an investigation. As the school nurse, I'm not required to do an investigation legally. So D is not something I have to do. Continue to assess the child for additional injuries. Yes, I'm legally required to do that. Photograph the injuries per facility protocol. That's the key thing, per facility protocol. So if my facility doesn't require it, then I don't have to do it. But if the facility requires it, then I do. A client newly diagnosed with type 1 diabetes states, "My life is ruined." Which response by the nurse best facilitates coping? So it says best facilitates coping. It could have said which of the following responses is best, because what I want to do is I want to have a therapeutic response. So what are therapeutic responses to people who express dissatisfaction with something? They're unhappy. They're, I don't know, whatever. They're unhappy, right? They don't seem to be coping with this new diagnosis. So what I want to do, therapeutic, is always, I'm going to pick the answer that encourages them to talk about how they're feeling. Okay. So when you think therapeutic communication, as long as they're not threatening suicide, if they're threatening suicide, I have to directly ask them, do you have a plan to commit suicide? But they're not threatening suicide. They're just saying, they're giving this sort of vague statement that their life is ruined. And so my job is to encourage therapeutic communication, which says, tell me more about what you mean by this. Many people live normal lives after they accept their disease. That's not therapeutic. Tell me more about what feels ruined for you right now. I may not use those words, but that is encouraging them to talk about how they feel. So I like B. You can meet with others who have diabetes if that would help. Well, that's true. We could do that, but that is not immediate. And there's a psych principle of immediacy. Immediacy says take care of it now if you can. And C is not immediate. Your feelings are temporary. You'll adjust soon. That may be true, but it's not therapeutic, because that's saying, I don't care what you just told me. Listen to me and I know better than you. A client with Alzheimer's disease wanders at night. Which non-pharmacologic intervention should the nurse implement? So Alzheimer's wandering at night. So I want to either prevent the behavior if I can, or I want to make sure they're safe while they're walking. Okay, so let's see. Install motion sensor night lights, lock the bedroom door from the outside, which means I'm locking them into their room, provide a structured daytime exercise program, offer a warm beverage with caffeine at bedtime, keep the room temperature slightly cool, or place a large clock and calendar in view. So install motion sensor night lights could help keep them safe by making sure they can see where they're going and they don't trip and fall. So that's a good option. Lock them into their bed at night, bedroom. That's locking it from the outside. No, that is, you can't do that. That's like illegal. I think they could sue us if we did that. Provide a structured daytime exercise program. So if we can get them tired enough during the day, maybe they'll sleep better at night. Offer a warm beverage with caffeine at bedtime. That's not a good option. Caffeine's not good. Could be a warm, even a warm beverage I wouldn't do at bedtime unless that's part of their routine already, because drinking at bedtime could wake them up and they have to go to the bathroom in the middle of the night. Keep the room temperature slightly cool. That's actually a good option. They don't want to get out of bed if they're sort of cold. They stay under their covers. Place a large clock and calendar in view that, if they wake up and they're like, where am I? What time is it? What day is it? They can see that on the wall. So those are good options. A postpartum client expresses ambivalence toward her newborn. Ambivalence means take her or leave her, right? Like, doesn't mean she wants to kill her. Doesn't mean she wants to get rid of her. She's just like, take her or leave her. Stating he cries too much. Which nursing action takes priority? So that means this person's sort of not really taking care of the baby. They kind of act like they don't care that much about the baby. So what do we want to do? Well, we want to make sure the baby is safe, but we also know that this is unexpected. So we want to try to figure out why mom is acting this way, because that's not an expected behavior. So I'm going to look for either answers that protect the baby or further assess mom to see why she's feeling this way. Assess the mother for postpartum depression. Well, that's a good option. I said I could do further assessment. Notify social services to arrange a home visit. I could do that, I guess. It doesn't seem as good as assessing mom, because if we can figure out what the problem is, I don't necessarily want to involve the authorities. She's not threatening to harm the baby. And it doesn't even say she's neglecting the baby. I'm not going to assume she's neglecting the baby. What I'm saying is she's probably at risk to do that. So we got to take care of her problem. Instruct the mother on swaddling techniques. That doesn't address any of the problems. Well, maybe it could help with the crying, but we don't know that. Document the statement and continue routine care. All right. So A is clearly the best answer. It is a priority option, which means I can only do one thing. And if I can only do one thing, I really need to figure out what's going on with mom. A client tells the nurse, if my partner leaves me, I'll kill myself. What is the nurse's best initial reaction? Ask if the client has a specific suicide plan, notify hospital security, arrange a family meeting with the partner, place the client on one-to-one observation immediately. So if a patient says, I don't want to go on living, I don't think anyone else wants me around, it'd be better if I were dead, if this happens, I'm going to kill myself, I'm thinking about killing myself, you have to be very direct. Okay, there's no increased risk for suicide by being direct. That's been well documented. And what they're testing is, do you know you have to be direct? Now, if you're an American, this is probably okay with you because Americans are very direct. If you're African or South American, those cultures are much less direct. So you just need to say, look, I got to do what's going to give me the right answer, not what feels most comfortable to me. Risk factors for potential violence in hospitalized clients include which findings? Past history of assault, active psychosis, recent loss of a loved one, chronic neuropathic pain, elevated serum sodium level, or impaired impulse control. So risk factors for potential violence. So what is going to increase the risk for violence? Past history of assault. Well, past behavior is the best predictor of future behavior. So if they've assaulted somebody in the past, there's a good chance they'll do it again. So A is definitely one. Active psychosis. Psychosis is hallucinations, delusions, and illusions, and particularly hallucinations and delusions. People think you're out to get them. They may think the pencil you have in your hand is a gun or a knife. And so psychosis definitely is a risk for potential violence. Recent loss of a loved one. I don't know of any reason recent loss of a loved one would increase your risk. I can't think of any reason. Chronic neuropathic pain. So neuropathic pain, I don't know, but could chronic pain increase the risk for violence? So what is a precursor to violence? So anxiety and agitation is a precursor to violence, okay? Anxiety and agitation. So if I have chronic pain, could I become anxious, agitated? I mean, it seems like I could. So if I were purely guessing, I don't know if I would pick this one. I would certainly consider it. But I'm here to tell you that pain is a risk, chronic pain, not acute pain. Chronic pain, I think because of the chronic nature and the anxiety and agitation that goes along with it when you can't treat it very well, can increase your risk for violence. Elevated serum sodium levels. I can't think of any reason elevated serum sodium. If there's a change in level of consciousness, it's a decreased level of consciousness, not increase. So I don't think E would be true. Impaired impulse control, certainly that would be a risk for violence. So I hope these all make sense to you, and even the chronic pain one I hope made sense to you. When educating staff about intimate partner violence, the nurse should emphasize that the strongest predictor of future lethal violence, so the key word is lethal. Do you know what lethal means? Lethal means killing you. Future lethal violence, the biggest risk of somebody killing you in the future. A history of substance abuse in the perpetrator, previous threats with a weapon, presence of children in the home, or unemployment in the perpetrator. So I don't know about C, but I know A, B, and D are all risk factors for intimate partner violence. Okay, they're all risk factors for intimate partner violence, but the one that's greatest risk for lethal violence is B, previous threats with a weapon. A nurse caring for a victim of sexual assault should implement which priority psychological interventions? Priority psychological, at risk, nurse caring for a victim of sexual assault. Okay. Provide a private, safe environment, ask detailed questions about sexual history, encourage the client to choose support persons present, offer prophylaxis for sexually transmitted infections, explain each step of evidence collected before proceeding, discourage discussion of feelings until the exam is complete. All right, so this is about psychological intervention. So basically, what is going to help psychologically them, maybe with fears, anxiety, that kind of thing. Okay, so provide a private, safe environment will help with the psyche. I don't know what to say. The psychology of the patient. A detailed, safe, a private, safe environment will help with the psychology of the patient. That seems true to me. Asking detailed questions about sexual history will help with the psychology of the patient. That doesn't seem true because they're going to think you're blaming them for the attack. Encouraging the client to choose support persons present will help with the psychology of the patient. That seems true. They get to pick who's going to be in the room with them. Offering prophylaxis for sexually transmitted infections will help with the psychology of the patient. That seems true because they may be worried about that. If it said like the morning after pill to prevent pregnancy, I would say that also would be true because they probably are going to be worried about what did I get from this? Am I going to be pregnant? Did I get a disease from this? So we can offer that. That'll help alleviate some of their concerns. Explaining each step of evidence collection before proceeding will help with psychology. That seems true. Discouraging discussion of feelings until the exam is complete. That does not seem beneficial in any way, shape, or form. So A, C, D, and E would be the right answers. When de-escalating a potentially violent situation, effective nursing strategies include maintaining at least one arm length distance, speaking in a firm but respectful tone, touching the client's arm to convey empathy, offering two realistic choices, ensuring a clear exit path for staff and client, displaying reassuring smile at all times. Okay. Effective nursing strategies for de-escalation. So maintaining at least one arm length distance helps with de-escalation. I would think so because they don't feel like you're getting in their face, right? You don't want to get up in their face and be like, you need to sit down right now, right? Like, no, that's not good. So arm length distance is good. Speaking in a firm but respectful tone helps with de-escalation. That's true. You're not asking questions, you're telling them, but it's firm, but it's respectful. That's true. Touching the client's arm to convey empathy. So A and C are opposites. It may not have seemed like that at first, but if you maintain an arm distance, you can't touch their arm in empathy. So I liked A, so I'm not going to choose C. Offering two realistic choices. So you can either sit in your room or you can do this. Like two things that I would allow them to do. We can go to your room or we can go outside. Which would you prefer, your room or outside, right? Those are two realistic options. I'm not giving them endless options. When you're in that level of anxiety, because anxiety is a precursor to violence, you're at high anxiety level, it's hard to make a decision. So D is a good option, ensuring a clear exit path for staff and client. That's true. You want a clear exit staff for everybody. Why would you want a clear exit staff for the client? Because that makes them feel safer. If they feel you're cornering them in a room, that is going to increase their threat for violence. I don't know if you've ever seen any like police interrogation videos. They always block the exit so the person feels like they cannot leave. Now, a lot of times they can leave. People are allowed to leave, but it's an intimidation tactic to try to get people to talk to the police. The police may even use a calm, respectful voice, but if they block the exit, it makes the person feel like they have to talk. And that may be fine for interrogation, but that's not what we're not interrogating anybody. Okay. So we want everybody to feel safe, like they can leave if they have to. Displaying a reassuring smile at all times. No, they're going to, especially if they're schizophrenic, they're going to be like, why are you smiling at me? What are you doing? What are you planning? Okay. So A, B, D, and E are the correct ways or strategies to help with de-escalation. A charge nurse observes escalating tension between two staff nurses. To manage this conflict, the charge nurse should. Well, I want to de-escalate. So all the things I talked about de-escalation, probably going to want to do here. Meet privately with each nurse to gather information. Maybe. Insist they solve the conflict independently. No, insisting doesn't seem like the word just not a good Nclex answer. Facilitate a joint meeting focusing on client safety. Focusing on client safety to manage the conflict. So if I meet with them And I say, look, I know you're not getting along, but we need to focus on client safety and have them focus on client safety and what they can do to take care of their clients rather than each looking at each other. That may help. That seems like it might be a good idea. Identify any unit policies related to the issue. Sure. I mean, that's a good Nclex answer. Assign the nurses to opposite shifts permanently. No, because we want to take care of the problem. We don't want to just ignore it and just isolate them from each other. Encourage use of you statements during discussion. You statements. You do this to me. You act like this. Okay, that's wrong. We want to actually encourage the use of I statements. This is how you make me, this is how I feel. This is why I did this. This is what's going on with me, right? And so usually when you're talking with clients and you're being therapeutic, you don't use I or me statements. But when two people are, when there's tension, those two people need to use I and me statements so that they focus on what they're feeling, not accusing the other person. So F is a bad answer. So I said maybe to meet privately with each nurse to gather information. That's good assessment. Like what's going on? What happened? Tell me more, right? That's fine. That's good. B is out. C is good. And D is good. So now there's more, right? There's more things we could do, but out of these answers, these are the ones that I would pick. Which interventions promote safety when caring for a client who has made threats toward staff? Promote safety. So I want to be safe for the staff and for the client. Keep the client's doors closed during interactions. Stand between the client and the exit. Remove items that could be used as weapons. Involve security or additional staff if needed. Document the client's threats and behaviors objectively. Promise confidentiality so the client will not be labeled. All right, promoting safety. My dog is down here, so I'm going to pet him. Promoting safety. Keep the door closed during interactions. That's not good. Like everybody's boxed in there. Nobody's going to be able to get out very easily. And in case of violence, you want everybody to be able to get out easily if they have to. So I don't like A. Stand between the client and the exit. I already told you that's not good. That makes people feel threatened. We want them to feel like they can get out if they have to. Remove items that could be used as weapons. Obviously, that's a good option. Document the client's threats and behaviors objectively. That's a good option. Promise confidentiality so the client will not be labeled. No, don't do that because you have to document it. Oh, I forgot to say D. I forgot to read it. I just skipped over it. Involve security or additional staff if needed. Yeah, I mean, that's always appropriate. That's not a problem. If needed, right? That's fine. Sometimes we put them like we let them know we might need them, but they don't necessarily need to come in the room unless we really think we're going to take this person down. And you want to try to de-escalate before you take anybody down. Okay, that's it. I hope that was helpful. Psychosocial integrity. I do get your messages asking me to do other things. I had somebody ask me about interdisciplinary care, and that actually is taught in the actual 21-hour plus clinic review. And it's really unique the way Mark teaches it, and I don't want to give that away. It's worth it. If you haven't passed Nclex in the past and you take that 21-hour clinic review, I think it'll really be worth it. There's quite a bit of stuff that we don't teach here on the channel that they do teach in the clinic review. It's really phenomenal. I don't make any money from it, so I'm just encouraging you to do something that I think is a high quality product. All right. I will see you guys later. Go play with my dogs. Take care. Thanks for being a part of the clinic review family.